My 22-year-old gelding has recently been diagnosed with cataracts. He's still able to see seemingly fine, no issues with riding him or getting him around in his field. Are cataracts common with senior horses, and what things do I need to take into consideration as he gets older, e.g. safety while riding, turnout? Oh, and then she says, thank you for the fun and educational videos.
Thank you. We always appreciate those, yeah. So 22-year-old, okay, so he would be a senior. There is a trend in the older horse to develop cataracts. It's simply everything wears and tears. You know, our bodies just wear out. And the lens in the eye, which is where the cataract exists, after a lifetime of inflammatory bouts, for whatever reason, it just develops some opacity or cloudiness. Now, this isn't the cloudiness that you see on the very outside of the eye or the cornea. That's completely different. This is cloudiness on the inside of the eye, and you'll notice it as light can't get through. Like you can't see, their retinas don't reflect anymore. You know how you can shine a light in the dark and all your cats will light up? So
how many cats do you have?
So it's definitely a structure inside the eye. There's a syndrome of foals can get cataracts. So when the vet comes out, to do the foal check.
But that's really cute, though. They have just small eyes. They're so cute.
Oh no, but you have to do surgery.
Well, it's very sad, of course.
Oh, sad but cute.
Yes.
I'm with you.
Everything about foals is cute.
But in older horses too, we have the age. There are some inherited causes for cataracts, and she doesn't mention what breed her horse is, right?
She does not.
Yeah. So we know Appaloosas tend to get the moon blindness or the equine recurrent uveitis, but there's some inherited risk factors for cataracts in thoroughbreds, in Belgians. Rocky Mountain horses in particular have a syndrome. So trauma also can lead to, but it's the repeated bouts of inflammation that are the cause. And so how do you notice it? You see it, but also you notice that your horse bumps into things. That's probably what she noticed. Doesn't walk as confident, may even start shying or spooking or jumping at things that they didn't used to. So for her, I mean, safety, it probably was the first thing that everyone thought of. Is sometimes they tell you when they're not confident enough to be ridden anymore, you know, and then you have to listen to them. But many organizations allow a horse with blindness in one and sometimes both eyes to continue to compete. So it really depends on the horse. Some of them, because it is gradual, tend to go into this stage of their life quite nicely because they get used to it. You know, if it comes on more acutely or suddenly, it's more shocking and they didn't have time to get used to it. Advice for her is try not to change the environment because they've learned the environment with their sight. And so when their sight goes away, if the environment stays the same, they can manage it, right? Sometimes having a buddy horse that they can rely on is really helpful because they kind of follow them around and they know what to do based on what their buddy is doing.
And it feels like now that he still has his vision is a good time to introduce that buddy if he doesn't have one. So that once he does eventually, if he loses his vision, he has a friend he can rely on. And
this may seem odd, but the other thing I would do for these guys, because they kind of don't know where they are, maybe keep him in a fly mask for protection, you know? So he's gonna bump himself on stuff. So put some protection on him so he at least protects his face from stuff. So, but yeah, surgery is really the only option. There's no medicine. There's no supplement.
And therapy.
Yeah,
like
and this was the very first surgery I did in vet school.
Wow.
Yeah, my first day of senior year. It's a really cool surgery. It's the same one they do in humans. Where they make a slit. It's awesome, but only Google this if you can tolerate.
So I like that
pictures.
You called this awesome, but then it was weird when I said foals were cute.
Right.
Okay.
Surgery awesome, foals. Yeah. But they just make a slit in the cornea. They stick a little tiny, like ultrasound probe in there. Make some tiny.
Okay.
Make some high frequency vibrations. Break up the lens. The lens is like glass. And then suck it out, sew up the hole, and you're good to go.
Wow.
Yeah, and it's called, I should say what it's called, phacoemulsification.
Ooh.
I know, I was
a good one.
to say that, yeah. So.
That was a good one.
But
I think
she'll be fine. You're
Okay.
totally fine.
Terrific. Well, good luck, Jody, and thank you for the wonderful compliment.